And we are really excited to welcome you to our second event of Domestic Violence Awareness Week, responding to the COVID-19 crisis. And we set up this week in honor of Domestic Violence Awareness Month, which occurs every October. And we wanted to set up this week of programming that could be accessible to people with and without a background in domestic violence work, kind of about a range of topics, raising awareness about domestic violence, but all within the context of kind of this unprecedented time that we're seeing, that we're living in these days with COVID-19. So we're really excited to have a full lineup of events all week. As you know, today we'll be on child abuse during COVID-19, and then we'll be reading a book that members of the task force created to kind of promote discussion about this issue. So we're super excited. We're thrilled to have Kathryn Robb with us today, who will be presenting. She is the Executive Director of Child USAdvocacy, an organization dedicated to ending child abuse and neglect through better laws for child protection. A lawyer by trade, she specializes in legislative advocacy, abuse laws, and statute of limitation reform. She's also a survivor of child sexual abuse. And notably, last year, Ms. Robb worked with New York Governor Andrew Cuomo and state legislators to pass the 2019 Child Victims Act. And as a board member and legislative advocate for the nonprofit Massachusetts Citizens for Children, she was instrumental in changing the state statute of limitation laws in 2014. Ms. Robb is a certified trainer for the Mass Kids Enough Abuse campaign, and she's also one of our incredible board of directors for the task force on domestic violence, the COVID-19 task force on domestic violence. And so we're so lucky to have her help us throughout the craziness of all of this. So thank you so much. And without further ado, I'll bring it over to you.
Well, thank you, Lita, very much. And thanks to all of the efforts. And I'm happy to be on your board. I just want to say from the start that if anyone has any questions, wants any data, or anything at the end of this, please feel free to reach out to any of these folks because they have my contact information, but I will also have it at the very end of this presentation. Hopefully I'll be able to get through this in about 25 minutes, maybe less. And I'm happy again to answer any questions, or if you need to email me for any reason, I'm happy to accept that too. So yes, I am the Executive Director of Child USAdvocacy. Let's just get this, sorry. And so we are a 501c4, and basically our mission is to end child abuse and neglect. And simply the way for us to do it is very different than a service type of 501c4, 501c3. What we do is we advocate for stronger child protection laws and policies. We also advocate for stronger just general policies for survivors of any type of abuse. The law that Lita just mentioned that was passed in New York that I worked on for 13 years and signed into law in 2019 by Governor Andrew Cuomo, has allowed a lot of Jeffrey Epstein's survivors to have their day in court. So that is really good news. So we work across the board. We work with our sister organization, which is Child USA, and with the leading expert really probably in the world and a very, very good friend of mine, Professor Marcy Hamilton at the University of Pennsylvania. Child USA is, that's me and Marcy. Child USA is really the think tank, and we get all of our data from the think tank. So we work directly together. They give me the data. I use the data in presenting my either testimony before some sort of legislative committee or speaking on local or national news or writing an op-ed or whatever it may be. So we work together. Marcy is quite a force. You'd be happy to know that she did clerk for Justice Sandra Day O'Connor. So she's really a terrific woman and really runs a great program. So what do? We work in all 50 states. We educate and persuade lawmakers to pass just basic common sense child protection and victim-friendly legislation. And when I say educate, I mean educate. A lot of lawmakers don't understand any of the data. They don't understand the depth of the problem. And so when we testify before legislative committees, we give them all of that data and we really try to educate them. We also draft and edit legislation. Several months ago, I just wrote a piece of legislation for the Commonwealth of Massachusetts that Senator Joan Lovely will be introducing. Actually, it has been introduced already, but of course, COVID is slowing things down for us. And like I said, we speak at press conferences, op-eds in local and national news and local and national news sources. So essentially what we do is we use data. We are data driven, we are knowledge driven, and we feel like it is the science that we can convince lawmakers to change their statutes, to change their laws, to make them stronger, to understand what does work and what doesn't work, how to end the problem, not promote the problem. So we really rely on science. Every week, Child USA, wonderful website, by the way. If anyone wants data, it is updated daily. It is probably the only website I know of this type that is updated daily. An amazing legal team. I actually just had a meeting with them a couple of hours ago, and they do data drops, which is really cool. They share them. They share them with folks through their social media and also on the website. And of course, we use this data when we're either maybe writing an amicus brief or introducing some sort of written testimony or oral testimony. We use all of this data. So we are data, data, data. As to the general issue or problem of child abuse, we focus more on child sexual abuse because it's a problem that folks unfortunately are just not dealing with. And I know that you've all heard about, the Philadelphia grand jury report, Larry Nassar, right? Jerry Steinfeld, I'm forgetting his name, down at Penn State, the football coach, Sandusky is the name I'm looking for. And all of these folks that, to really understand, these news stories, how big this problem is. And the problem is really enormous. In my view, it is the pandemic, but no one talks about it. Child abuse, child sex abuse, the data, depending on where you look, is on average, whether it's CDC data or FBI data or academic data that we use, 1 in 4 girls and 1 in 6 boys will be sexually abused. Oops, I just lost my light there, by the time they reach 18, and that 90% of the perpetrators are known to the child. 78, as you can see in the slide, percent of sex abuse happens in the home. That notion of stranger danger, it's just rare. It's not the big number. It's only about 7%, as you can see. So we use a lot of this data and we share it with legislators, leave behinds that we give legislators to educate them, but also in oral and written testimony as well. So the problem is really enormous. And the other thing that we try to educate legislators on, especially, I'm sure a lot of folks have seen this. In fact, we just had a case out of California, a suit that was brought by the 2 gentlemen that were suing Michael Jackson and his entities. Unfortunately, it was dismissed on another matter, not really the sexual abuse matter. But the average average age of reporting of sexual abuse is age 52. That's what all the data says, which is why we really need to change our statute of limitations. And that's what we did in California. And I'll talk more about what we did in 2019 and a little bit in 2020. But the fact that the average age is 52, by the time someone comes forward to report abuse when they were, 7 or 8 or 9 or 10, the doors to justice have closed. And probably the most important thing is that the perpetrator remains out there, able to continue to harm children. So again, this is some data we use. And I often share this when I do my when I talk before committees or I'm always in press conferences, and I tell them, because that's me at age 10, that it took me over 30 years to speak up. And this is the case for most survivors. Like I said, the average age is 52. Some of the data suggests that probably close to a third, maybe a little under a third, never report. So they go to their death with this secret. And so I really try to use my personal story in a sort of a darkness to light path, right? To really educate lawmakers, educate the public when I'm speaking on the press or I'm on a local news channel. I was on Lester Holt's NBC News. They did a story a year ago about the Child Victims Act in New York. So I really try to share my story, but as an intelligent thinking woman and a mother of 5, I try to explain to them really what's the reasoning behind why we need to change these laws. And here are the reasons why children delay in sharing sexual abuse. It's really the shame, the guilt, the fear of not being believed, the trauma. We do a lot of research on traumatology, the science of traumatology, and the effects on the mind of a child. Maybe inability to communicate the abuse, and lots of other things that result from the trauma, whether it's substance abuse when in early teen years or even much later, depression, post-traumatic stress. The list goes on and on, unfortunately. So there are just a ton of reasons why kids don't share this well into adulthood. The other thing we like to share with folks is what are the 3 compelling public policies that are served by changing sex abuse statute of limitation? Like what are they? The first one is what I sort of mentioned earlier, is that it identifies previously unknown child predators. So basically, when we identify hidden predators, we make kids presently safer. And parents need to know this information, teachers, institutions, society in general needs to know. It also shifts the cost of the abuse from the victims to the predators, or perhaps the institutions or organizations that hid them, that moved them around, that type of thing. We saw that a lot, unfortunately, in Boy Scouts of America abuse and in the Catholic Church abuse as well. And finally, it educates the public about the prevalence and the harm of child abuse so that families and society and our legal system, of course, can protect kids more effectively. 90% of child victims never go to the authorities. So by the time they find the courage to do so, the doors to justice are closed. And most attorneys, most DAs will say, we cannot arrest, or we can't bring a civil claim against this person or entity because the doors have been shut by this arbitrary statute of limitations period. And as many may know on this presentation, is that adverse childhood experiences really have just a tremendous effect on the life of children. And there's a lot of evidence that there's this impact on future victimization and perpetration of any sort of future harm. So further domestic abuse as adults, that type of thing. And of course, what we see, the correlation between child sexual abuse and any social, emotional, cognitive impairment is enormous. Also disease, disability, substance abuse. Again, this is another, unfortunately, really long list where we correlate the abuse to later impairments in life. And these later impairments in life also affect our systems in terms of the cost of abuse on our society. So we look to those numbers as well. And here's one of the numbers: the average lifetime cost of any child maltreatment. So this is not just child sexual abuse, but physical abuse, neglect, emotional abuse, that type of thing is, we're getting really close to the $1 million number. And the economic burden of sexual abuse is in the trillions, which is really astonishing if you think about it, just the cost of the abuse on the systems. Then came COVID, as we all know, which is why we're doing this remotely, right? And what are the present challenges that we're seeing in relation to COVID and the appropriate responses by our leaders, or I should say most of our leaders, to COVID-19 and the health risks of this pandemic. And of course, as you all know, schools have been closed. I have two teenagers who are not happy about remote learning. So lots of kids are doing the online type of education, as we all know. Now, it's really important to flatten the curve and to make folks stay at home, right? That's really important to make us all safer, so we can drop the amount of positive cases and drop the amount of deaths and burden on our medical systems. And you guys all know this, we hear it in the news constantly, right? But unfortunately, when children stay home, abuse rises, especially when we understand that the vast majority of abuse to kids happens within the home, right? So when we know that, we just see these really astonishing and alarming rises and increases in child abuse in general. So what do we know thus far? And all of this data with sites, if anyone wants the sites to any of this data, I'm happy to share it with everyone. I didn't want to sort of weigh this down with a lot of footnotes. But anyway, significant rise in domestic violence, and lots, all depending on the jurisdiction where you are and the reporting agency. They're looking to reports of up to 50%, which is really alarming, right? And of course, as we all know, that domestic violence, partner on partner type of abuse, right, has a profound and lasting effect on kids. So we're super, super concerned about that. There's also this increase in online sexual abuse, right? So we have fewer eyes on kids, right? Because we don't have teachers and pediatricians and coaches and YSO leaders, having their eyes on kids. So now we have predators online and in the home. They see an increased opportunity to groom and to exploit children. We also see child neglect is surging, of course, due to unemployment, evictions, foreclosure threats, stress, depression, health concerns. Of course, everyone is enormously concerned about just, being safe, just generally being safe. But what that does is, we all know, it increases the stress in the home. And if your parent has also lost a job, or they're worried about being evicted or foreclosed on, that increases stress. And generally what happens is the increase in stress increases the amount of harm to kids. That is physical harm, emotional harm, and sexual abuse type of harm. So this increase on stress on caregivers also increases their reliance and their increased substance abuse, which further increases violence in the home and harm in the home. And the other thing that we're seeing in the data is that parents are just not taking their kids to the doctor because they're afraid, or maybe they can't afford it. They can't afford to have that filling filled right now. They can't afford to take a kid to a specialist. I think there's a lot of data on the significant drops in ER, that people were just like going to the hospital so much later than they should have. So we're seeing this in relation to kids' health. It's really quite alarming. So this is what the early data tells us. Now, Child USA, and I don't expect you folks to read all this, but I can share all of this data, and I just went through a lot of it. But we have this is our data drops, so the drop in teachers' eyes and doctors' eyes and coaches' eyes on kids is like dropping significantly, and then the increase in what's showing up on Google, and how many people are looking up in Google about domestic violence or that type of thing. That was a study done in Australia. Anyway, I can share all this data. So we have lots and lots of data. And of course, as I was saying earlier, remote learning and all of those stay-at-home orders, although they're really, really challenging and really hard, unfortunately, it means that we have fewer eyes on kids. We also have some studies that indicate that 50% of child sexual abuse occurs in the home. So that's really alarming. If kids are, there's no safe haven for them at home, right? Home is not a safe place. School is a safe place. After school is a safe place, right? Going to practice is a safer place. Going to a youth serving organization activity is a safer place. So the more kids are in the home, the more we are concerned. So again, those of teachers, doctors, coaches, administrators, health teachers, nurses at schools, YSO leaders, all of those safety nets have been significantly reduced. So very, very concerning for us, and really is consistent with the increase in abuse that we're seeing. And also the decrease in the amount of abuse that's being reported to to social workers and that type of thing. It's not being reported because we don't have these safety nets and eyes on kids. And more data, teachers and school administrators are the #1 reporters of child abuse. So if that's removed or significantly reduced, if folks are on a hybrid type of teaching, school is using a hybrid method, certainly the amount of time that people can really have their eyes on kids is reduced significantly, and you just can't see it through a computer screen. It's just not the same thing. So now I just wanted to talk about some of our legislative initiatives and what we're doing. Of course, I talked earlier about statute of limitation reform for child sexual abuse, but we do other things, anything to do with child protection, ending conversion therapy for LGBTQ youth, ending child marriage, eliminating any of those exemptions that are typically religious exemptions for vaccinations, ending FGM on minors. And we do a lot of family court reform. And we do some other things as well. I just actually asked a senator today, excuse me, to introduce a bill banning the use of the sale of child sex dolls. That is really becoming a problem. And they're using the images of kids on the dolls. It's quite alarming. So that's going to be another fight that we will engage in. But just sort of briefly for folks who don't quite understand what a statute of limitations is, because I'm not quite sure of the understanding of the audience. So basically, it's just a time limit. It's this arbitrary time limit, for typical, types of torts or crimes, or maybe even contracts, whatever it may be, for victims to prosecute their abusers, either in a criminal way or in a civil manner. And for the criminal statute of limitations, that's the time given by the government to criminally charge a perpetrator. For a civil statute of limitations, that's just the time that victims can sue their abusers. So it's just this period of time, this deadline for filing claims. I should just add that in a criminal statute of limitations, because we've had a lot of bills and legislation that we've worked on that have eliminated and revived older claims. And we cannot revive old claims for criminal statute of limitations. We can for civil, so there is some justice, but we cannot for criminal because of ex post facto constitutional issues. And just to give a little bit of understanding about what we do with these statute of limitations is, and the language and the importance of the language within the bill that we're either supporting or we're editing or that we drafted ourselves. So the extension, excuse me, is obvious. It's just an increased amount of time that a survivor can bring the claim. Elimination removes the statute of limitations entirely. Excuse me. And then we have retroactive laws, and those are either revival or windows. And again, retroactive laws can only be used for civil claims. So, for example, those survivors in New York of Jeffrey Epstein, they couldn't bring a criminal charge, but they could, because of the law that I worked on, bring a civil claim if they were under the age of 18. So essentially, revival revives a claim that was previously barred. So what we'll sometimes do with some legislation, it's really based on the jurisdiction, is we'll look to an extension. So maybe extending the statute of limitations from age 25 to 55, let's say. We always shoot for 55 because of the data of the average age of disclosure of 52. But we like to throw in language, even if your claim was previously barred. So if you're past the statute of limitations period, and you are presently barred when we pass this new law, if we have revival language, you could then bring your suit. Whereas window language is basically an open window. This is what California just did. North Carolina just did this. Montana, New York just extended their window. So basically it's a start and period of time, start and end period of time, whereby victims who were previously barred can bring their claims. So we like a full elimination, and we like an open window. Vermont actually gets the gold medal on this. They passed a bill at the end of 2019 that completely eliminated the statute of limitations. They just said, no more, we're done, zero tolerance, and a wide open window that is stuck open. It never closes. So it's really a zero tolerance. They, of course, again, could not retroactively change the criminal statute, but they did extend it, which is great news. Excuse me, they removed it. They completely eliminated it. So the other things that we do is, like I said earlier, we draft legislation. We do a lot of public policy in our legislation drafting. We write and submit opinions really all over the country. I've written many op-eds all over the country. And because I'm a 501c4, I'm allowed to sort of take my gloves off. And if there's a lawmaker that killed my bill, I'm not happy, so I'll take my gloves off, and in the op-ed, I'll really go after them, right? So I'm allowed to do that as a 501c4, and quite frankly, I enjoy doing it, especially when then I know that some big institution was behind getting a lawmaker to keep their finger on the bill so it doesn't move. We also speak at press conferences. I've talked on many podcasts, conferences, rallies, marches. We are really the voice for the voiceless. And we really educate lawmakers on the science of traumatology and the harm to kids. And we often go through all of these different this very long and alarming list of the effects of child abuse on kids. Unfortunately, this is probably one of the last times I spoke, second to last time I spoke before COVID really hit. By the way, there's no easy way to get to Kansas from Boston. It took me a full day to get there. It was crazy. Anyway, to not a very friendly Judiciary Committee. So there's testimony. We lots of interviews with the press. This was when I was on the Lester Holt show, which was a lot of fun. So we just like to get out there. We just want to be out there. And I spoke at the Aspen Ideas Festival. You know, anytime I can get in front of a camera or a mic and really push folks to make stronger laws for kids and fairer laws for victims, adult victims as well, of course. We also give report card rankings. We tend to use a lot of shaming that can be really effective. You know, lawmakers really care about two things. They care about their reelection and they care about their egos, right? So they don't like to get that F or that D, you know. We just actually moved New York up to an A because they extended their window another year, which is great. So we'll do a lot of things like this. This was John Flanagan was a leader of the New York Senate for, I don't know, 12 or 13 years, and he absolutely refused to move our bill, and he had the power to do it, right? It was like Mitch McConnell kind of power, right? And so we put these wanted signs up all over the State House. We also actually at a Trump golf course in New York when Senator Flanagan was doing a fundraiser, and it was just a ton of fun just to get out there and really shame those who deserve to be shamed for not protecting kids. We marched over the Brooklyn Bridge with a bunch of folks, got a lot of press on that. And had great success by all of these methods. You know, 2019 was just an amazing year. We passed legislation in 23 states and the District of Columbia, and we had 9 states that revived their statute of limitations, which was just a great success year. It was a big year for us. Again, I can share all of this data if anyone wants it. And here we are with Governor Andrew Cuomo at the signing. He and his staff became good friends of mine, really good people. So with the success of 2019, we're like, great, we're going to go after a ton of other states, right, to make these laws better. And we had 28 states introduce SOL reform. Unfortunately, what happened was COVID shut down every single legislative body. And really anything that lawmakers want to pay attention to. I mean, lawmakers are focused on really 3 things: COVID legislation, which of course makes sense; social justice and police reform legislation, that also makes sense; and of course the November elections. So with COVID just literally shutting down state houses and the inability to really get to lawmakers, we also had just COVID and social justice stuff like suck up the oxygen. Anyway, so we wait for 2021 for those legislative sessions, and every state's a little different. Some have really long sessions, some have short sessions. Maryland has the shortest session, a 3-month session, and we'll just get right back in the arena and keep fighting for kids and survivors. And this is really our mission, is to protect kids, but also to give justice to survivors of any sort of abuse as kids. So thank you. And here is my email and website. If you folks want to reach out, happy to give you any information and assist in any way we can.
Awesome. Thank you so much, Kathryn. That's awesome. And we'll put your email and website maybe in the chat as well for everyone.
Terrific.
And then we're going to switch gears now, and I'm going to get, I guess, Sarah to share her screen.
Hi, guys.
Hi.
All right.
I should probably stop share, right? Yeah, there we go.
All right. Can you guys see?
Yeah.
All right. So for those of you who don't know us, our names are Sarah and Clara. I go by she, her. I use a she, her, hers pronouns.
I also take she, her, hers.
And we were actually college roommates and best friends, and joined the task force on domestic violence. It's something that we felt very strongly about. And so today we wanted to share a little bit about the backstory of Joan's COVID tale, and then do a little bit of a reading. So I'm going to introduce the book, and then Sarah's going to go ahead. She was a TDM major, so reading and doing voices is kind of her thing. But basically, I think, and Kathryn, thank you so much for your talk. I think it touched on a lot of things that we were thinking about when we were thinking about the inception of the children's book, which was we were worried about kids from vulnerable households being stuck at home, and sort of no longer having school as a safe space. And we really wanted to reach them. But I think with a lot of the work that we have started to do, we've realized that we need to be really careful about the language that we use, because we want to be first and foremost helpful, and if we can't be helpful, we at least don't want to be unhelpful. So that started sort of a conversation, task force wide conversation. Really, all the teams got involved, and we started to brainstorm. All right, well, how can we reach kids? And we came up with the idea of maybe creating a children's book that would be sort of really fun, have a lot of images, use rhymes, so everything would rhyme, and that would be sort of a camouflaging technique, but it would also contain some safety information. Perhaps we would have our heroine, stuck at home under stressful situations, and we would say, okay, this is something that she does. Or, when she's in school over Zoom, she shows her entire face. And that's something that helps sort of identify if a kid is experiencing, physical abuse in the household. Maybe that's a clue. And so we were really, I think we were always aware of the fact that this book had its limitations. We wish we could do so much more. But after having a lot of conversations with schools therapists and with social workers, the bottom line across all of the meetings was child services is extremely complicated. So as much as it sucks, the best thing we can do is get the community involved. And that was a hard reality for us to accept, but I think eventually we came to terms, and we were like, all right, so the goal is not to sort of identify who is in danger and call child services, but rather we want to provide relief. And so we got some artists together, we met with school therapists, and we wrote this book. And now we have it here. It's not perfect, and if you guys have feedback, by all means,
Absolutely.
Yeah, send it our way. And I think our next steps would be to reach out to after school activities that are usually already targeted for kids who are who come from vulnerable homes. So perhaps, after school programs that provide meals for kids, or after school programs like City Step, where children who come from vulnerable households dance together. So reach out to those programs and sort of distribute them our book. That would be sort of, in our ideal world, sort of the next step. We're in the process of course, acquiring funding. Mm-hmm. We really want to make sure that the product is solidified before we go out there into the world. So without further ado.
And also this version of the product targets like a kindergarten age reader. Mm-hmm. And so one of our hopes in the future is to create potentially different versions for different reading levels. But yeah, so this is Joan's COVID tale. I'm 6 years old. My name is Joan. Keeping safe from COVID means staying at home. I live in New York and I like to play ball. I play in the park and I'm getting tall. My family's here too. I'm never alone. It's my parents, my brother Max, and me, Joan. Max and I play our favorite board game, but without our friends, it's just not the same. I sure miss my friends, but just down the hall are Miss Lee and Miss Smith if I need help at all. I'm going to school. It's all online. I'm handing my homework in on time. If at home I'm feeling stressed, I read books, play tag, or lay down and rest. When I am in school on the internet, I pay attention so I don't forget. If I ever have any questions to ask, I can talk to my teachers after class. Being stuck at home, my world feels small, but with all of these tools, it's not bad at all. When you're bored at home with nothing to do, I hope you'll read my tale and learn something new.
Do you want to do the kid?
Yeah, so now I'm going to pull up this after reading activity.
You have to stop sharing and reshare, I think. Otherwise, I can't see it.
Mm-hmm. Great. Okay, now we're going to do the end of story activity. Yeah, so the end of story activity is to review the suggestions for like coping tools that we've provided for kids. So one is ways to keep busy at home and just spark joy, relieve stress, depending on what the environment is. So there's a coloring activity, which is in itself one of those activities. And then we ask them, what do you do for fun at home? And they can come up with either things that Joan did or that they do that make them happy at home. More coloring. This is important. Who are 3 people you can trust and talk to, just to remind kids that whether they're adults in their building, in their neighborhood, or on Zoom that they don't necessarily see as much all the time, to just keep those people in mind. More coloring. And then this more specifically is like in moments of stress, techniques for coping. If you're worried, what are 3 things you do? And so we hope that kids will either take suggestions from Joan, things like napping or playing games or listening to music. Yeah, and then there are more sort of coloring activities.
Yeah. So I think, as you guys can see, like these are subtle techniques. So, really we have reached out to the community. We are trying to, in a way, sort of suggest harmony in the household in some form or another. Of course, something that we are thinking about right here, we have internet, and we specifically didn't use the word Zoom because we don't have copyright, so we have to be careful about the language we use, and that's one. But we are also aware that there are some things we want to change, maybe to reflect less privilege. So that's a lot of some of the diversity you saw in there. We try to include one transgender character. Mm-hmm. And so these are all things that we are actively thinking about, and we are hoping to expand this. We also, I don't know if you guys saw it, but at the very end of the children's book, we have an email, which is a specific email that's just Joan's COVID tale at gmail.com. And the idea would be that if someone wanted to reach out and someone sort of picked up on the flags that were, or someone had a red flag, that they would reach out to us. But something that we also want to think before we get the product out there is like, okay, what would be our process if people reached out to us?
Yeah.
So that's a little bit about what we've been up to. I don't know if you guys have any questions or anything you'd like to, suggest.
We're definitely open to feedback as we try to, strike a balance between offering help to children and not providing a book that parents will see as someone is checking on my children.
Something else that a school therapist suggested to us was that even as kids go back to school, this might be a really interesting tool for school therapists and social workers to work with, because what's happening is that, even for the kids that do have Zoom therapy or Zoom services during the pandemic, they're having a really hard time connecting to kids through the screen, especially knowing that there are parents around. And so a lot of the concern hasn't just been, okay, how our kids are in a vulnerable state. It's like we can't even access them, even when we have the tools in place. They are so far away from us. And so a school therapist did suggest to us that this was actually a really good tool, a really good platform to connect with kids, because you could talk about Joan sort of as a third person character and portray a lot of, if you're struggling at home, you could portray onto Joan. So it is something that we're also thinking about, and we're actively sort of seeking out to people to see, okay, what would ring a bell? What do you think kids would really open up to? Mm-hmm. So yeah.
Bravo.
Yes, thank you guys so much. If anyone, I know everyone's muted, but if people have questions either for Sarah and Clara or for Kathryn, we have some time for discussion for these last 10 minutes. So you can either pop a question in the chat or if you prefer, please turn on your camera and flag me down so that I can unmute you. Any questions or thoughts so far? I guess I'll just ask quickly, like, Kathryn, what are your thoughts kind of coming from your perspective of an advocacy organization on a tool like this?
Yeah. Can you hear me? Can everyone hear me? Okay, great. First of all, wonderful, just as a mother too, just what a sweet book. What I was thinking about, we did a lot of social media stuff when COVID first came and there were school lockdowns. And I'm not sure how this will work, but I'll just throw it out there, right? So some of our concerns were about kids having too much media, right? So just there was always too much, like you got to turn the news off. It's too scary for kids, especially the audience is for, kindergartner, right? So that's pretty scary. But then the other thing that we also advocated for, for parents to, I don't think this can be worked in, Sarah, but that when you maintain calm, you create calm in your kids. Mm-hmm. And I certainly know when, as a parent, when I lose my, my kids were more, they were tense. If I was upset, they were tense. So, even about the election, or something, right? So, and then the third piece that I thought, and again, I'm not sure how this could work in or not, or it could be something else, or maybe even in the workbook, or is mindfulness. Mm-hmm. I mean, we hear that term over and over again, right? But really, if there could be some skill or some little strategy, even if it's 2 minutes of mindfulness, goes such a long way.
Yeah. One tool that I do have experience with mindfulness, and one tool that I found really helpful, especially for kids, is it's like a sensory exercise. So name like 5 things you can see, 4 things you can hear, 3 things you can smell, 2 things you can touch, and 1 thing you can taste. I think taste is a variation of that. But it's a grounding tool, so that when you're overwhelmed, you can reconnect to the physical sensations that you're experiencing. And I think that's a great idea. It could even be like name 5 things that were in Joan's room or like in your room, just
yeah, just to sort of take take the focus away, because that's what it's about. Or, I mean, it could even it could be a simple 2-minute breathing exercise even,
I
Right.
also think with the whole media, we hadn't thought about that. But you're right that some of our drawing and coloring in has to do with screens, and I feel like there are ways in which we could change that, and have the color activities be focused more towards activities as opposed to sitting in front of a screen. So yeah,
Right.
thank you.
Yeah. And probably more of the TV, I would guess. I mean, because kids are learning on a screen. So you can't get away from that part, but maybe the TV would be a better one to,
Absolutely.
Thank you.
And I think I'm sorry, I just have one more thought, that to somehow communicate that, to feel that that to have feelings of worry and concern about uncertainty, that it's normal.
Yeah.
So that it's okay. It's actually, it probably wouldn't be normal if you weren't having a response. Right. And so that probably helps kids feel a little bit more centered as well, and adults, quite frankly. But to know that it's normal for us all to feel edgy, nervous, have uncertainty. I mean, no one likes uncertainty, right? But really, that's what life's about. But that's another whole topic. And I'm just wondering if could be some piece about that it's normal to feel this way.
Yeah.
Right. Yeah, I love it. Good job. It's really great.
Does anyone else have any questions or thoughts that they wanted to share? If not, I'll stay on in case people have questions they want to ask privately, etc. But we'll be passing along all of the information, emails, everything, so that people can reach out if they'd like. And for the meantime, thank you so much to Kathryn and to Sarah and Clara, and to all of you for joining us. We have a lot more events this week. Tomorrow we'll be having an event on the intersection of domestic violence and politics. So that'll be focused on key pieces of domestic violence legislation, mandatory arrest policies, and then obstacles to voting for survivors, given that next week is election week. So tune in for that if you're interested. Sign-ups are still available. And thank you guys so much. Hope everyone has a good evening.